Okay, hello everyone. I'm Dr. David Ajibade here with the Brain and Body Foundation, and our guest today is Dr. Stuart Campbell, who is the CEO of Axial Pharmaceuticals. And in a short while, he's going to be talking about some of the exciting research that he's into. But as you know, folks, solutions to brain disorders have been few and far in between. And I think, in my opinion, it's all been because we've looked at the brain and the brain alone. And with increased diagnostic abilities and technology and looking at the other parts of the body, for instance, the guts and the microbes, we're beginning to see that there's a lot that is influencing the brain coming from the gut. And this is exciting information because for those of us in third world countries where we don't have access to the fMRIs, the MRIs, the SPECT, the PECT, all the different screening technologies, we know that we can do something about the gut. And so this is, in my opinion, this is a shortcut to improving brain health in areas where we don't have access to top of the line medical care. So this is really, really exciting. So without further ado, I'm going to say, welcome to the show, Dr. Campbell.
It's a pleasure to be here, David. Thank you very much for the invitation.
Absolutely, absolutely. So I cannot wait to start hearing about some of the exciting things that you're doing over at Axial Therapeutics. But before then, just give us an overview. Before we go into the slides, give us an overview and just set the backdrop. Put the setting for us.
Sure. I'd be happy to. So what we focus on and what the research is focused on is really understanding the interaction between the microbes in the gut and the brain, as you highlighted in your introduction. And not just understanding what that relationship is, but understanding it with the goal of developing new ways to treat and possibly even prevent some of these brain disorders and mental illness that have been historically resistant to treatment. And I loved your the way you laid it out as we need to think outside the brain to get a more holistic picture of what drives behavior and what drives mental health. And we always say you are what you eat, for example, and what does that really mean? Well, we always think of the nutrients that we absorb when we digest food, but the microbes are there eating the same food or digesting it in a slightly different way, creating a different set of products that become part of our circulating systems. And so what we find is that up until maybe just the past decade, we really didn't pay much attention to what that contribution of the gut microbes could be to not just mental health, but the body's health in general. But maybe in the last even shorter time period, there's been an emphasis on how the brain and the gut can communicate in a way that we could, if we learn about it the right way, then we could come up with ways to intervene at the right time, in the right way, to maybe prevent or treat different disorders. And that's really the motivation here. So for the presentation today, I'd like to first give an overview of what the gut-brain axis is. And you might hear this term in the mainstream media, the gut-brain axis. Well, what are we really talking about here? Secondly, I would like to then give a very brief overview of when we talk about the gut microbiome, what do we mean by that? And then bring it together to say, and these are some of the ways in which the gut microbes and the human host can interact in a way that can either lead to better health or health issues that need to be managed. And then maybe go with an example in the case of autism, where we know a lot more now than we did 5 years ago even about the relationship between the gut and the brain and how the gut microbes can actually contribute to the autism behavioral spectrum. And we're developing therapies based on that we think could generate some improvements in behavior without the side effects that come with some of the drugs that you might get from a psychiatrist, for example.
Right. Exciting. All right. Do you want me to let you share screen? Should I share screen now?
Great. Yes, please.
Can't wait. All right. Yeah. Does that give you permission?
Looks like it. Is this it? Let me know what you see.
Seeing the slide sorter now.
Okay, so I'll go to the starting point here. Bear with me. You should see this on the screen as a slide now. Is that correct?
Yes, sir.
All right.
Perfect.
So I'm going to give you an overview, and it comes from Axial Therapeutics perspective, but it is very generally applicable to anyone who is working on the gut-brain axis and the relationship between microbes in the gut and the function of the brain. Toward the end, we'll get to very specifically some of the things we're doing as a company to try to improve the lives of people with autism. But the concepts behind it are not our concepts. They're the concepts of the research community, and we're just leveraging them to develop new therapeutics.
Right.
So in the US, we have this safe harbor forward-looking statement thing that we have to disclose that kind of covers us in case we say something that could be misinterpreted. But with that, let's get into the fun stuff. And so first, I'd like to give you just a high-level overview of what this gut-brain axis is. So how does the gut talk to the brain? And vice versa. It's really a two-way communication channel. And what we find is that there are really three avenues of communication between the gut and the brain. And you'll notice I have not introduced gut microbes here yet. So I'll layer those in a moment.
Okay.
But in the quote old days, before we really focused on the contribution of the gut microbiome, we would have a basic understanding that the gut and the brain talk to each other. For example, when you're hungry, that's your gut telling your brain to eat something. When you eat enough, it's your brain telling your gut to stop eating. Nowhere in there do we invoke the concept of the gut microbiome. But there are really three avenues of communication here. The first one is what we call the enteric nervous system. And this is a major component of the autonomic nervous system that kind of operates in the background, controls our breathing and our digestion and the movement of our GI tract. But the enteric nervous system specifically is all the nerves that control everything from the movement from the nose all the way through to the anus. So any ingestion of food and how it gets processed and broken down all the way through, all those movements are controlled by the enteric nervous system. And there are other functions of the enteric nervous system as well.
And just a quick one, Stu, the enteric nervous system, I've been told that it has more, is the second most abundant nervous system after the brain, even more than the spinal cord. Is that correct?
Yes, and in fact, it has the nickname of the second brain.
Second brain.
And you can actually, in many cases, disconnect the enteric nervous system from the brain. The connection's usually through the vagus nerve.
Mm-hmm.
And you can actually snip the vagus nerve and the enteric nervous system will still function. So it really is a second, almost separate entity that it does talk to the brain, but the function of it is not required that it talks to the brain.
Interesting. Okay.
And so it controls GI motility, release of enzymes to digest food, movement of cells to take up nutrients, etc. And so it's pivotal to our survival and our health. And so this is just one avenue. And we think of the gut and the brain talking to each other. If you think of a hardwired network between two places, telephone wire, let's say, between two places, that would be the enteric nervous system. But we all know now with cell phone towers and everything that you don't need a hardwire connection between two places to communicate. And so this could be represented by the circulatory system. So in here, we've got two pieces. There's this hormonal axis, or sometimes called the HPA, or hypothalamic pituitary adrenal axis. And it's really how the hormone levels between the periphery and the brain all talk to each other. It's really known as the neuroendocrine system. And it regulates sort of this, for example, the fight or flight syndrome, right? You get really scared and you either fight or you run away. And that's an instinctive reaction. And it's driven by these hormones and the neuroendocrine system. So things like cortisol related to stress and so on. This is another way the gut and the brain talk to each other. And then there's the other piece of this circulatory system related. So think of the circulatory system as the vehicle or the avenue through which all these occur. It's really the neurotransmitters and small molecule metabolites that come from the gut and reach the brain and vice versa. So you think of things like GABA, serotonin, dopamine, all these things are all produced both in the brain, but in many cases, the majority of these neurotransmitters are produced in the gut. And so if we think about norepinephrine or adrenaline, right, that whole cascade, that axis being produced in the gut, that increases levels of dopamine in the brain. So there is a really clear connection through the blood between the gut and the brain. And the third piece is really the immune system. And many of us think about the immune system as, okay, if you eat bad food, you get a fever, you get sick, and that's your immune system trying to fight this off. Or if you get, you breathe in, you get pneumonia, and your immune system is fighting that off, or the flu or something. But what many don't realize is that roughly 80% of our immune system is contained in the gut tissue. And so it is a major, if you think about it, there are two organs, so to speak, that interface between us and the outside world. The two major organs are our skin and our GI tract. If you think about it, our mouth is open, our anus is open, and we have this ability to interface with the outside world. And that's where our immune system is developed, is educated, is maintained, and it's that interaction between things that we come from the outside world, and there needs to be an appropriate immune response of the host. And it happens at that interface, and the gut is one of those major interfaces. And so what's known is that microbes and their products can sometimes even cross the gut-brain, the gut barrier, and get into the body. And that could be, for example, in a disseminated infection of some kind. And that can lead to a very massive and problematic immune response that can actually sometimes kill people. So we think about, how does that relate to the brain? Well, if you have activation of the immune system in the gut, that can actually lead to inflammation in the brain in certain cases. And how that communicates is something that's actively being researched right now. So if you think about the gut as one way that we educate our immune system to establish who is friend, who is foe, and whether to fight this one off or let this one live with you, this is all happening in our gut all the time. And so the one piece that we call the elephant in the room is the gut microbiome, right? This is really the major piece of how all these processes happen. So within, and so the gut is a major source of neurotransmitters. It's a major source of molecules that, or entities that modulate our immune system. And in certain cases, microbes can either improve or deteriorate the barrier in our gut. So we call intestinal permeability. So there's this whole phenomenon that you'll hear more in the mainstream media as leaky gut. Well, what does that mean? It means that there's, if you think of the junctions between these, I'll go to my pointer here and see if I can maybe highlight this a little bit better, but the junctions that keep these cells that line the gut as a barrier, right? And you want to keep those nice and tight so that things that are in your gut don't just get through into the tissue in an unobstructed way. You have to have the right controls to control what gets in and when. But there's certain bacteria and things that can lead to a leaky gut where these junctions between cells can get loose. And now you start to have infiltration of much bigger things like intact bacteria and can lead to infection and so on. So I think the more appropriate term, and we're starting to see this now more in the literature, is rather than just the gut-brain axis, it could be the microbiota gut-brain axis, or MGBA. And this now recognizes the contribution of the microbiome to all these processes, to the gut and the brain communication pathways. And so what do we mean by the gut microbiome? This is a big question, and some people think it's all bacteria are bad, all viruses are bad, and we need to get rid of them, but actually are a pivotal part of our health and survival. And so we're going to take a bit of a detour here and talk a little bit about the human microbiome. And we show here silhouettes of 5 individuals, and they all have different things filled in. And what that's meant to convey is that we all have a gut microbiome, but everybody's gut microbiome is different slightly from the next person. So there's no 2 microbiome profiles that are identical as far as we know. Almost like there's no 2 snowflakes that are the same, right? They're always a little bit different.
Right.
That's a Canadian analogy. It might not work as well in Nigeria, and in Canada we have a lot of snow, so people would put on.
Yeah, we don't have any snow in Nigeria, I can tell you that.
But let's look a little bit more closely at the gut microbiome and see, what are we talking about here? So I think it's really surprising when you start to understand just how much we are microbe versus human. So if we look at the total number of cells in the human body and compare that to the total number of bacteria in our gut, the bacteria outnumber us about 1.25 to 1. So there's about 25% more bacteria in our gut than there are cells in the human body.
That is crazy.
It is a really remarkable statistic.
Well, I hear it's been downgraded, though. At one point, we used to think it was up to 10 times as many.
That's right. And that was based on some pretty old assumptions about the surface area of the gut and the volume of the gut. And it was, I think, in 2019, somebody came out with a much more accurate and precise assessment of what the number of cells actually is, and they've downgraded it from 10 to 1 down to close to equal. So, but still more microbe than human. So
yes, still yes.
And so
remarkable.
But if you look at the genes, so if you take all the genes in the human body and you compare them to the number of genes that are carried by the microbes that live in our gut, it's 100 to 1 in favor of the microbes. Really, really diverse in terms of what they can do. And this doesn't even consider yeasts, viruses, bacteriophages that also live in our gut. This is just bacteria.
Right.
And so with this number of bacteria living in our gut, it might be good to understand where they are and what different parts of the GI tract have different populations of microbes. And what you can see here is if we look at the concentration of bacteria in different areas of the GI tract and the volume of those pieces of the GI tract, you get to a total number of bacteria in these different parts of the GI. And the vast majority of the bacteria live in the colon. This is 10 to the 14 bacteria. This is trillions of bacteria. In our mouths, we have billions of bacteria. And dental plaques that build up over time they're produced by bacteria, and they use it as kind of like a scaffold in which to live and build a community. So if you think about, you move into a blank field, an empty field, and you build a village, okay, the village, the huts and the buildings that make up the village are the dental plaque for the bacteria.
Okay.
And the dental and the bacteria are the inhabitants of that town or village or city or whatever. And you think of the dental plaque as just the buildings and the streets and so on. So billions. And then as you work your way down from the mouth, down to the stomach, and into the duodenum and jejunum in the small intestine, you're seeing still significant numbers of bacteria, but orders of magnitude lower than what you see in the colon and the mouth.
Right.
And you say, well, why is this? You have billions in your mouth, trillions in your colon. What happens in between? Why can't they all just live everywhere? And what we have to do is look at who's where and what the conditions are that make life either hospitable or hostile for bacteria. And so we look at things like pH, how acidic or basic is the environment, and do bacteria do well in those environments or not? So in the lower small intestine and the colon, you have a pH that's about neutral. Depends on whether you've eaten or you've fasted, et cetera, and what you've eaten. But generally speaking, it's roughly neutral. The stomach is much more acidic. It's a much more hostile environment for bacteria. And so bacteria typically don't grow very well or survive being in the stomach, except for things like H. pylori that causes ulcers. Those are bacteria that are just fine living in a very acidic environment. But typically, it's this neutral pH that tends to support bacterial growth best. We also have to think about the flow rate. So you can imagine if you have a pipe or a hose that the water is flowing through very quickly, they tend to not have buildup of dirt, bacteria, and so on. But when the flow slows down, you can now create pockets where the bacteria can stick and survive better. And this is true in the colon, right? So you go from a very thin tube in the small intestine now to a very fat tube in the colon. The flow goes down. Now you've created a lazy river of sorts where things are just flowing very slowly, and you now have a much more conducive environment to bacterial growth.
Well, the argument would be for the mouth, there's very short transit time in the mouth, but the mouth still has a lot of bacteria though. So how do we explain that?
Yeah, it's a good question. So in contrast, so there's, I think, two answers to that. Number one is we think about a short transit time, but we are constantly salivating all the time.
Okay.
And even though we're swallowing all the time, the transit time or the flow rate is actually relatively slow.
Okay.
The second is we have a lot of hard surfaces in our teeth. And that can create the ability of bacteria to lay down these plaques, which you now have a very rigid environment that is able to withstand and in a way disrupt the fast flow that might be there, like when you drink water, for example, right? And so if you think about it, what type of city survives a flood better? Is it one where all the buildings are made of concrete, or one where they're made of wood, right? And it's usually the ones that are made of concrete that survive better. So now you've got this hard surface that supports bacterial growth on your teeth. And that is more conducive, that allows them to survive and grow a little bit better.
Got it. Okay, I see.
And so then there's this whole thing, the mucus layer. So there's mucus all the way through our GI tract. And so there are some bacteria that really, really like to attach to mucus and live there. And it's a very sticky environment. So even though you might have fast flow, they're almost like a sticky surface that allows them to withstand the hostile environment. So these are just some of the things that influence where bacteria live in our GI tract. And then, of course, things like diseases that either slow down the transit time in the GI tract can lead to overgrowth of bacteria in certain regions because the flow is now slow, for example. And then diet can have a huge impact on what types of bacteria grow, where they grow, and in particular, a high-fat diet can lead to selective growth of bacteria that make it easier to absorb fat. And it becomes a vicious cycle, right? So you've now got bacteria that help fat be absorbed, which means you crave more fat, which means that it just begins to, and this is why it can be really hard for people sometimes to lose weight and maintain that weight loss for long periods of time. So not just the diet, it's who's living in your gut as well that can make a difference.
Right, right.
And so to continue to move on to, what is it about our gut microbiome? How does it change over time? And I think it's really important here to understand several things. The first is that when you're a baby, you inherit almost all of your microbiome from your mother, assuming you were born by a traditional birth through the vaginal canal, and that you're breastfed and you spend a lot of close proximity with your mother. If you're not breastfed or born by C-section, for example, you could end up with a very different microbiome because you would inherit majority of your microbiome from the environment. Okay, and these are known risk factors for things like autism, for example. So these are known if you're born by C-section, if you're not breastfed, these are all arguably not the natural way that things work, that you create a risk profile for autism. It's not to say that if you don't breastfeed, your child is going to become autistic, but the risk is slightly elevated in those situations. And so it takes the first few years of life for the microbiome of an individual to set and get its basic structure. And by that we mean, what are the types of microbes that will actually live there and reproduce? And then by the time you hit puberty and adulthood, you've got maximum number of bacteria in your gut and maximum diversity. And then as you age, it starts to go back the other way. You start to lose bacteria, you lose diversity. And it's really interesting that while nobody, to my knowledge, can look at a microbiome profile and tell you whether it's healthy or unhealthy, we're not at that stage yet, there are some general rules. And the general rules are a more diverse microbiome and higher number of bacteria in the gut are considered better for health. And so if you think about the things that would help you develop a diverse, plentiful microbiome, it's eating a diversity of foods, a well-balanced diet with lots of fiber, natural foodstuffs that are not highly processed and things like that. So the more you can get back to fruits and vegetables and even meat to some extent, that these are things that can hasten a healthy microbiome as judged by the number and the diversity of, in as much as that predicts the healthy state.
Okay,
of the
so the two core things is you got to have diversity, and what was the second one?
The number, so more bacteria. Yeah, and so you look at something like autism, where you look at a typical, or there is no such thing as a typical autism microbiome, but you look at the microbiome of somebody with autism, and they will have often fewer bacteria, and less diversity. And we don't quite know how to interpret all that yet, but it's pretty clear that this is the type of thing we see with kids with autism.
Got it. Now, can you tell region by region in the world, by looking at the bacteria, where this person probably lived most of their lives, or we're not there yet either?
We're not quite there yet. What we're doing, what you see being done in the field is a lot of epidemiology work to try to characterize different regions. And there are some pretty amazing epidemiology studies that have been done that are going to start shedding light on that. So we may, I don't think it'll be a long time before we get to the point where you could look at somebody's microbiome profile and say, they're from West Africa, or they're from Canada, or whatever. I think that's a ways off, okay. Because so many things can influence the composition of the microbiome.
Got it.
So one of the things that people often hear is, oh, I'll eat this probiotic, or I'll eat this food and it's going to change my microbiome, it's going to make me healthy, or if I don't do that, I'll get sick. And I think one of the really critical things here is that because an individual's microbiome is largely, the framework is largely set within the first few years of life, it's really hard to make permanent changes, big changes to somebody's microbiome. And so if you look at actually most controlled studies, so within a geographic region, dietary changes can induce only modest changes. And even say you take somebody who is a vegan and someone who's an omnivore who'll eat anything, it's really hard to alter their microbiome by simply modifying their diet. You can make small changes temporarily, but then your microbiome is a very resilient community, so it will go back to its set point pretty quickly. And so there are often significant differences geographically, what we call Western diet and traditional diet, but you can't, to your point earlier, the quote Western diet is becoming more ubiquitous in different countries, especially in Asia. And so you might see somebody has a microbiome that looks like someone who's on a Western diet, but you won't be able to tell whether they're from Asia or North America, let's say.
I see.
So you can make temporary changes by changing diet, but it's really hard to make wholesale permanent changes. You can do this to some extent by doing what they call a fecal matter transplant. So you can wipe somebody's microbiome out, almost, you really knock it down with aggressive antibiotics treatment, and then you can replace it with the microbiome from another person. And this can lead to a major change in somebody's microbiome. But just because, this is actually a really important point, just because the composition doesn't change a lot, doesn't mean the function can't change a lot. So we have to separate function from composition. Okay. And this is because, again, let's use the city analogy, right? If you think of the microbiome as a very densely populated city, you have various functions that just need to happen. You have transportation, you have water and sewer, you have electrical grid, you have all these different infrastructures that just need to be maintained and produced. But that's the same whether the city is in Nigeria or if it's in Massachusetts, in the US. The composition of the people may be different, but the functions overlap. So you now have, and so what you find in the microbiome is that there's a lot of functional redundancy within the microbiome. And so you can actually have the same composition performing different functions and different functions performed by different compositions, or the same function by different compositions.
And there's a way to influence that, or there isn't? You
can, and this is where you can influence it with diet and other things. And so if we think about, and this is getting a bit technical here, but if we think about how do we even know this, right? And there's all these technologies that have really come to fruition over the past decade or so, maybe a little longer. And if you start to think about profiling the microbiome in different ways, and you start to understand the difference between the composition and the function, you need several technologies. And I'll just really quickly go through some of these. So if you want a descriptive overview of your microbiome, that would be who is there, right? And for this, you could take a stool sample and you can process it in a way that you can do what they call metagenomics. So you're looking at all the genes in the microbiome and you can say, okay, this is now the composition. But just because the genes are there doesn't tell you whether those genes are being expressed, whether they're functional or not. And this is where you have to go to other technologies like transcriptomics, proteomics, and metabolomics. And these are telling you not just who is there, but what their functional capacity is. What are they capable of? And then what are they actually doing? And so if you go across this slide here and you start with who's there, what are they capable of, and then what are they actually doing? What are they producing? So this gets to the function, and this is really about who is there. So, and you need this whole picture in order to start to understand what parts of the microbiome are contributing to health and disease. Does that make sense?
Yes, it does. This is a fantastic diagram, by the way. This is fantastic. I love it. Someone once said that only 1% of all the microbes are actually harmful. Is that a fair statement?
I would say it's a reasonable statement, and I think everything is context dependent. So we have a lot of microbes in our gut that if they got out of the gut and into our tissues, they could wreak havoc, right? They could, yeah, right? And because a microbe performs something bad, like it can kill tissue in one context when it's by itself, you put it in the context of 1,000 other types of organisms and they keep each other in check.
I see.
So,
got it.
And again, you can sort of use this city analogy again, right? You've got honest and dishonest people, or you have honest people who are capable of being dishonest and vice versa, and everything is context dependent. And part of it is if you have laws and a court system, et cetera, that keeps people in check, they're going to generally behave.
Yeah.
But if the government falls, then people behave in bad ways. So to me, it's all context dependent. And it really, so to say 1%, I can't say whether that's right or wrong, but the majority of microbes are not harmful.
Got it.
The vast majority. So I think maybe that's the best way to think of it. And so bringing this back now to the gut-brain axis and we'll use autism as a case in point. So if we think about all of these metabolites being produced by microbes in the gut, and we try to decipher which ones can talk to the brain and impact behavior and so on, it's a very complex question. And with what Axial is doing, and that has come from our scientific founders lab at Caltech and research by other people as well, we start to understand what metabolites from gut microbes can actually contribute to behavior. And so it's really this avenue, this circulatory system avenue, that we're focusing on in autism. That's where we are. And so let's detour again a little bit and talk a little bit about autism. And if we think about what defines autism, it's really 3 classic symptoms, right? So social deficits, so withdrawal from social situations or social dysfunction, language impairment, and stereotyped repetitive behaviors. This is how the psychiatry world defines autism. There's also a formal process you go through to determine whether somebody's autistic versus have some other type of challenge that they're trying to manage. And there's really two main ways of diagnosing autism, two main tools that are used: the Autism Diagnostic Observational Schedule, or ADOS, and the Autism Diagnostic Interview, or the ADI. And they're both used quite often in many countries to diagnose somebody who's autistic and to understand whether it's autism or something else. But beyond the core symptoms of autism, and I want to be really clear about something, that everybody has some level of social impairment. Nobody's perfect. Nobody, and we all have different ways in which we respond to stress or stressful situations, fear, etc. And so there's a whole part of the autism community that would argue it's a spectrum. Most people are on the spectrum somewhere, and that's not necessarily a disorder. It's just where you are on the spectrum.
Yeah.
And we respect that. We think that that is a reasonable position for people to take, because we all have our challenges and we all manifest our stress in different ways. However, there is a whole set of co-occurring conditions that can make life really, really challenging for somebody with autism. And it could mean the difference between them being an active participant in society or not participating in society at all. And quite often it can be driven by what we call these peripheral or co-occurring conditions, and or non-core conditions. And things like anxiety, very prevalent in the autism community. Irritability, very prevalent. And many also have other medical issues like seizures, obsessive compulsive disorder, mood disorders. And you mentioned earlier, do they have attention deficit issues? And they do. It's not everybody, but there's this really wide range of co-occurring conditions that many kids with autism have at least one of these, sometimes many.
Right.
And so if you think about, let's say that you have this issue of repetitive rocking, for example, and that could be how you manage your anxiety. So you get in an anxiety-inducing situation, and I may bite my fingernails, someone else may do something, twitch or whatever. Someone with autism may just completely withdraw and just rock. So if you think about all these co-occurring conditions, it could be that if you could manage these, it might bring the severity of some of the core symptoms down, and maybe mean the difference between them being able to hold a job and not hold a job.
Right.
And so this is where we're focused with some of the work we're doing, is trying to get a handle on some of these co-occurring conditions that can make somebody with autism's life more challenging. And we want to make that easier for them and their families. One of the things that often gets ignored or historically has not been noted is the prevalence of GI symptoms in kids with autism. And depending on the study, you may see that anywhere from, if you look at, someone did a very nice meta-analysis of 84 clinical studies and looked at the range of GI symptoms that occurred in the autism population. And you see that it's roughly half is a good metric, right? Half these kids have GI issues. And so the question here is, if you have all these GI symptoms, could the gut microbiome be playing a role here? And this was our first lens into the gut-brain connection in autism. And so what we do know is that in autistic individuals, GI disorders correlate with worse behavior, increased anxiety, higher levels of cortisol, stress, and increased stress. And so if you think about that, is it possible then that GI symptoms could be more than just a co-occurring condition? Could it actually be driving other things that we equate to more historically to behavioral or brain issues? And so here is where we need to start looking outside the brain for potential ways to intervene in autism. And so this is where we need to look more closely at the way the gut and the brain communicate with one another. And so what we do is we look at the relationship between the gut microbiome and autism. And so I mentioned a couple of these earlier, but many kids have GI symptoms, which correlates with autism severity. And we know that the composition of kids with autism, the composition of the microbiome of kids with autism is different compared to controls. So when you match the controls by age and demographic and so on, you have one group that's autistic, one group that's not, you will see that the gut microbiome composition is different. But there are several other risk factors that would implicate a role for the microbiome. One is if the mom gets an infection of a certain type during her second trimester that leads to a certain type of immune response, that child's risk of developing autism is increased. It's not definitive, but it's a risk factor where the risk is going up.
Does the kind of infection matter?
It's usually, from what we understand now, and it's very much an emerging field, it's one that would induce an interleukin-6 or IL-6 response, is what we understand so far. But there are several things that could do that. So if you could do a cytokine profile in somebody who's sick and you see it's an IL-6 response, that could be an indication of a risk. But there's just not much you can do about it at this point. It's just something that we have to note so far.
Is there anything that can be done, like, for instance, I know vitamin D3 is one thing that helps with IL-6 and cytokine storm issues and all that. I mean, are there things that maybe we can start recommending to pregnant women to help strengthen their immunity so that even if there is an infection, they can overcome it, maybe?
So I have to be really careful here because I'm not a medical doctor. So the last thing I'm going to do is recommend any kind of treatment for somebody. So I would say,
got it.
Go to your doctor, and if your doctor says, "Oh, it's this type of immune response, I'm going to give you this to manage it," and it's well grounded, that's probably the only thing I would say is consult your physician if you can.
Got it. But it's good for people to know this so that they can strengthen their immune systems, a supplement or whatever it is. Okay.
Right. And so if your baby's born by C-section, there's an elevated risk. If there's reduced breastfeeding, that's another elevated risk. And one of the things that you'll often see is kids who get a lot of ear infections or other types of infections early on in life, they will start to, the doctors will prescribe cycles of antibiotics, one after the other. And what happens is it's not just treating the infection, but it's taken orally, so it's depleting your microbiome. And it's right in the formative years of your microbiome when you're a year to 2 to 3 years old.
Right.
And that's when your microbiome is the most malleable. And so if you start hammering it with antibiotics, you're going to alter perhaps what the ultimate microbiome profile looks like when you're an adult.
I have a few patients like that who are hammered with antibiotics maybe for an ear infection, and they came up with autism, and so the parents are having to deal with that for the rest of their lives.
Exactly. And so what you'll see, one practice that we see here is once they go through a certain number of repeated infections and antibiotic treatments and it doesn't look like the ear infections are getting better, is they'll actually put the tubes in their ears to let them drain. And the tubes naturally will fall out when the kids get older, but it can be used as a way to sort of break the cycle of antibiotics use when they're young, because that has some really long-term health implications. So
just for the doctors listening, please, when you're giving antibiotics, especially for kids, I know you have to do it. Please prescribe probiotics as well, because that will help in replenishing the gut. Of course, you have to choose a really good one. Is that am I safe? Is it okay if I say that, Stu?
I would say that yeah, you have to make sure any probiotic that you take, you have to make sure it's a good one, where the producer is very reputable, and the composition of that probiotic actually has some relevance to known studies that have been done to show that they're actually helpful. So there are a lot of probiotics out there on the market that they're supposed to be live microbes, but they're not live for very long. Depends on the producer. So you just have to be careful.
Got it. So they have to do their homework too.
Yeah, absolutely. And so this is actually an interesting thing, because all these things I mentioned before, all correlations, they're not causation, right? So we have to start to understand, is there any causal relationship between the microbiome and autism? And the very first study that really looked at this was a little over 20 years ago. A British group did a very small study in kids with, actually not British, a US-based group, Sid Feingold and Hannah Wexler. And this was actually a study that was, I think we'll look back and say, this was a really important study that got ignored for many, many years. It was a very small study in 11 kids with autism. And what they did was they tried to remove and replace the microbes by doing very aggressive oral antibiotic treatment for 8 weeks. That's a long time for vancomycin, let's say, right? And very high doses. And they followed that by giving probiotics for 4 weeks, right? To your point, right? Try to replenish or influence how the microbes grow back. And what they found was that during the treatment, their behavior improved. So while the microbes were being depleted and replaced with the probiotic strains, things got better. And then at follow-up, after they stopped the antibiotic treatment, and I can't remember how much longer after follow-up it was, they all reverted back, right? So this was like, you change the microbiome and you change behavior. And so this was actually the first example that I know of where they actually were able to take a microbiome modification approach and impact behavior. Now, obviously, you're not going to take kids who are autistic and treat them perpetually with antibiotics, right? This is just not a reasonable way to proceed. I would never advocate doing that. Right. But it does give us a little bit of a window into what could be going on. And so there's another group in Arizona here in the US that took a much more sophisticated approach here, and looked at taking adolescents with autism, going through a very prescribed treatment of antibiotics, and then rather than come back with probiotics, they came back with healthy microbes from healthy people. And they put it in a pill and they gave it to them by capsule. And what they showed was that the kids who were being treated improved in their autism scores, repetitive behavior, the aberrant behavior checklist. All their scores got lower. They improved while after several weeks after they completed the fecal matter transplant. And then they looked at them again 2 years later. So they haven't had any intervention in this regard for 2 years, and their scores were still down. So they fundamentally changed how the microbiome, what the composition is, and also what the function is in a durable way by wiping it out and replacing it with microbiota from a healthy human. And so this prompted a group, a company called Finch Therapeutics in the Boston area that is developing a very fine-tuned version of this. And they're still not yet in clinical trials, but they're working toward that. So it's quite an exciting development. Not convinced it's for everybody. The antibiotic treatment is pretty aggressive and can be very discomforting. It's temporary, but and you have to train the kids often to take the pills and so on. And so, you know, the way we went about this is slightly different in that, and this goes back to our scientific founders laboratory at Caltech in California, where in 2013, he published the first paper that highlighted that it might be the metabolites of the microbes that have been contributing to behavior changes. And this was the first example of demonstrating that a metabolite produced by a microbe, if you give it to, in this case, a normal mouse, you could induce autism-like behavior in the mouse. This says small molecule metabolites being produced by microbes can actively contribute to behavior changes in a way that's consistent with autism. And so this was our starting point at Axial Therapeutics. And we said, okay, how can we intervene? And so our hypothesis here is that, and I apologize for the chemistry for the non-chemists in the audience, but I think it's straightforward to see that there are several metabolites that have similar structures. So you don't need to be a chemist to say that this and this look alike, but they're different chemicals, right?
Right.
This and this, they have similarities. And so you see this class of metabolite that are produced by microbes in the gut can get into circulation. And we show this here, that if this is the gut barrier and you have all these microbes in the gut, and you have these metabolites, which are these little circles, and you see if you've got both elevated metabolites and a leaky gut, you could see that you could get significant levels of these metabolites leaking into the bloodstream, getting to the brain, altering behavior. So our approach was to take this molecule we call AB2004, it stays in the gut, and it sops up these metabolites in the gut so that you end up with a much lower amount of metabolite influx or efflux out of the gut into the bloodstream. So this is our approach. So now we have a therapy you take by mouth, it stays in the gut, you pass it in the stool, so it doesn't need to get to the brain, it doesn't need to even get into systemic circulation, and you have a chance to actually modify the metabolite profile and then modify behavior as a result. So, so this is a drug that we're developing. It's in clinical trials at the moment. And I'll skip ahead a couple of slides to show that when we give this drug to adolescents with autism, we are able to significantly reduce the metabolite levels. So the drug is doing what it's supposed to do. And when we measure their behavior, we see those kids that have very high irritability at baseline, they take the drug for 8 weeks and their irritability scores are significantly lower. So we've improved their behavior. And this is great, you see it on a graph, but then the real question is, what does it mean to the families? And we had several families come and say that their son was doing something for the first time that they never did before, like bathe themselves without the parents' help. And these are teenagers, right? So, or go out and be able to eat at a restaurant for the first time without having to be extremely anxious about where the food is coming from and is it clean and safe. They were just able to eat, be able to engage with their parents in a conversation about what they're watching on television instead of sitting with a toy or an iPad and watching the same thing again and again and again. They're able to actually engage, right? So these are the things that tell us we're actually having a difference, making a difference to that individual and to that family. Now, we obviously have to go through several more rounds of clinical study to prove that this works more broadly in the autism population. So it will still be a few years before we're able to know whether this drug could be introduced into the market. But the concept is a brand new one, and it's one that we think holds great promise, not just for autism, but for other neurodevelopmental disorders as well. So we're quite excited about where this is headed, and we are hopeful that the next round of clinical trials will bear out that our hypothesis is correct here. So I just have one more slide here, if that's okay, and it's just a summary that with respect to autism, that GI symptoms are prevalent, and they can impact core symptoms and non-core symptoms of autism. We have shown in mice, at least, that we understand what's happening in the brain at a level where we can account for the changes in behavior. We have not published this data yet, but we will be soon. And we've demonstrated that the gut microbiome can actively contribute to symptom development in autism, and that if we alter the metabolite levels in the right way, we stand a chance to actually alter the behavior as well. So that's, I hope, a good overview of the microbiome, its role in different in health, and maybe a little bit of information on the gut-brain axis and how we've been able to study it in a way that leads to promising therapies for things like autism.
This is fascinating. Can I take it back?
Yes. Where would you like to go?
No, I just wanted to share it.
Take back. Yes, sure, absolutely.
So we can see, we can eyeball each other. But
yeah, there we go.
Wow, Stu, that is fantastic. I gotta say, really exciting for people like me again, because again, we can say, listen, we can actually start dealing with the chemistry in a safe way. I mean, from what you've shown, this doesn't seem to have major side effects. Like you said, it stays in the gut, and therefore it doesn't leak into circulation and can cause other problems you're not sure about. And so what you said about is still causative. We're not sure whether it's causative or correlative. I think that's pretty much should have been established by now, that microbiome.
I think, yeah, we've made some good strides toward establishing causation. And the question is, I would say we don't yet fully understand the entire scope of the causation and what's playing a role. There's still a lot we don't know. But what's clear is that based on what we do know, we know how to manipulate it in a way that can lead to benefit, we think, for people with autism.
Great. And you used irritability. What was the other one?
Anxiety.
Okay.
Yeah.
But the results you were talking about refer to other things like increased cognition, ability to pay attention to what they're doing, and so on and so forth, which are, you use those two because you could measure them. Is that those two?
Yeah, I think those are anecdotal stories. So the parents would see that all they know is my child is doing something in a way that they didn't do it before, they weren't doing at all. And whether you can explain that by changes in cognition or not, I think we don't know that yet. So if you think about something where somebody may have perfectly normal cognition, but their anxiety level is so high that it impairs their ability to function properly in a certain situation. And then you remove that anxiety or that irritability, and now you get to see what's behind that in a way. So not that we may be fixing those fundamental processes, it's just we're dialing down some of the things that may prevent them from doing the right thing. So does that make sense? Yeah.
It does. It does. That's great. Okay. So you also said you'll be looking into other learning disabilities and other behavioral disabilities as well. Are we seeing any, when we say we, I'm really referring to you. I'm not doing the research. I wish I could be doing the research too, but we're not there yet. Are you seeing any commonalities among the different childhood behavioral learning disabilities in terms of metabolism?
Yeah, so there's a lot less known about many other childhood neurodevelopmental disorders around the metabolites. So autism is the most investigated one to date. But some of these symptom similarities, I'll give you an example. A lot of kids with a genetic disorder called Rett syndrome. It's a rare disease, but they'll go through a regression period where many will develop autism-like symptoms. And then some will grow out of those and some will persist with the autism symptoms.
Okay.
What's underneath that? Is it metabolite driven entirely? Is there a metabolite contribution? We think there is, but we need to do more work there to really understand what metabolites are different and whether they could be actively contributing or not. But at least there's the basis to go look now, which we didn't have before. So.
Well, what we found out at the foundation was that when we started giving high quality probiotics from the company I mentioned to you before, even for autism, for Down syndrome, and I think for another, even for Alzheimer's disease as well, we found some improvements in everything from behavior to speech and all those things. Right now, I'm wondering whether it's the metabolites that were created by these probiotics or whether it was something else.
So if you think about all the avenues in the gut-brain axis, so metabolites is just one. You could be altering the immune system in those people as well. You could be altering their enteric nervous system. And so we have to always keep in mind that there are multiple avenues of communication between the gut and the brain. So it's not always the metabolites. It just happens to be a contributory one in autism as far as we are concerned. It doesn't mean it's going to apply across all of neuroscience, let's say.
Got it. And I know you have to leave soon, but how does this all apply to adults, to dementias and other things, the degenerative conditions? Are you looking into that as well?
Yeah, we are doing work in that as well. And so far, our focus there has been on the enteric nervous system route and not on the metabolites per se. So we're going after an entirely different avenue between the gut and the brain. And we have good evidence in mice and a little bit of evidence in Parkinson's patients to show that this might actually be the case. And so we have the metabolite story is very poorly understood in neurodegenerative conditions. That's changing now. You're starting to see some studies releasing data on the metabolite changes in different groups of people. But what's clear is that for things like Alzheimer's, Parkinson's, ALS, and these other things, the microbiome of the disease population is different from the controls. And we're sort of at that early stage where we were with autism a decade ago. And so you can see the same types of concepts being evaluated in those populations. But now, since the technologies are so much cheaper and easier to access, the progress is going to be faster and faster in those fields, I think. So very exciting.
Absolutely, absolutely. Well, we hope we could play some sort of a role, no matter how small, in this journey of discovery you're making, because it's super exciting for sure.
Yeah, we're excited. And I appreciate the opportunity to discuss it with you, and I hope I answered your questions okay.
You did, you absolutely did. Thank you, thank
Okay.
you. So, in time integrity, we're going to have to wrap it up here, and I know you've been very gracious with your time for this, so thank you so much, Stu. Do you have
Great.
any final thing you want to leave with?
All I would say is thank you for the opportunity, and if you would like to have me back at some point, I would be glad to do this again, or maybe update you on our results as they come out. And just maybe if things continue to look good, I'm sure it would be exciting to people to hear the progress.
Awesome. Really appreciate it. So, folks, stay tuned for more information. And again, you can see more wonderful talks and studies like this on our site, brainandbodyfoundation.org. And the Axial website is
axialtx.com. AXIALTX.com.
TX for therapeutics. Okay,
Yes.
great. Yes. Awesome. Well, take care. God bless.
Thank you, you as well. Thank you, David. Okay.
Thanks to you. Bye.
Okay. Bye-bye.